Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Preoperative assessment, preoperative checkup, history. In the history examination, in the pre-anesthetic checkup, we should see the history. Examination should be done. In the examination, we can do general physical examination or systemic examination can be done. In the systemic examination, we should examine the cardiovascular system and respiratory system. In the respiratory system, breath holding time is important. Normal breath holding time is more than 25 seconds. Borderline breath holding time is 15 to 25 seconds. In high risk cases, the breath holding time is less than 15 seconds. Airway assessment. Airway So in pre-operative assessment, we see history and examination. On examination, we should do general physical examination and systemic examination. In the systemic examination, we should see for cardiovascular system and respiratory system. And after all this, we should even check for breath holding time. If breath holding time normally it is more than 25 seconds. If it is 50 to 25 seconds, then we call it as borderline. If it is less than 15 seconds, then it is high risk case for anesthesia.
thank you and thank you for watching.